Thank you, Kaho, for giving me this opportunity to chair this very, very important session on scaling technology building on COVID. So we all know that we have, I think we were in technology from before COVID. We will not say we were not there in technology before COVID, and CAHOTECH has been conducting these technological updates even before COVID. But yes, now is the time to build up and scale up on what we have learned, what experience we have gained, and have we scaled up? Have we grown? Have we progressed? Have been able to adopt the technology based upon the needs of the clientele, the needs of the recipients? What better way to have people with us who have gone through it, who have been in this, and who have got their own case studies and own success stories to share with us. So I think I'm very grateful to CAHOTECH for giving me such an elite panel who have the experience, who are going to share with us today some of their own individual case studies and will tell us how the technology can be scaled post-COVID to take it to the next higher level. I have with us, we have some very important personality with us. And why I say personality? Because this personality is multifaceted and has dealt with the government, with the private, and has primarily been responsible for making several inroads into our government sectors for harnessing technology and scaling technology as per the needs of those sectors. So obviously, I think you all must have guessed whom I'm talking about. It is Mr. Milan Narendra, who is a partner in Ernst & Young. He has got almost 22 plus years of experience in the government sector, which is probably just half of what I had in the government sector. But you know, I am not a technology man and he is a technology man. He is one of the leading experts in the area of health, e-governance and government administrative reforms in India. He has been extensively involved in various technology-intensive projects and in citizen service delivery projects. Now, I'll just touch upon some of the few transformational initiatives that he has undertaken in this country of ours. You see, he has brought about a digital transformation of the vaccine supply chain to cater to the needs of our universal immunization program in India. He has also been the technical support unit for our COVID vaccination platform. He has been a great support for the design of the Ayushman Bharat digital mission building blocks. He has provided a lot of support to various states in their digital transformation journey across the healthcare sector. And he has been actually responsible for implementation of your hospital management information system in government hospitals in our state of Bihar. He has also been, involved in change management of employee states insurance corporation. And he has also been not only in India, he has been abroad as well, looking after digital transformation of social protection program in Cambodia. Now, his involvement is there with the NHA, with your Ayushman Bharat Digital Health Mission, and with so much of experience with vaccination programs. I think nobody better than him to share his experience with you that how this technology can be scaled and to make healthcare not a mixed up healthcare delivery, because I think Dr. Ajay said it's a mixed delivery. I would call it is a mixed up delivery. And we want to now really proceed to that mixed delivery, which is ideal for all our population. So over to you, Mr. Milan.
Thanks a lot, Dr. Kapoor, for your kind words, and good evening, everyone. Really great to be here. And I would like to thank CAHOTECH as well, led by Mr. Som Mittal and Dr. Agarwal, for organizing this at the right time, I would say. Given that we are coming out of COVID, very well, we are all now free, moving around, things are coming back with a lot of vengeance, I would say. And the entire healthcare ecosystem itself has learned quite a lot in the last 2 years. And that's where maybe it really gives a lot of, I would say, impetus to the kind of work we have been trying to do across different initiatives. If you look at last 2 years or more, everything came to standstill. And all of us have seen that. All sectors came to standstill or probably got impacted in a big way, while a sector like health sector had to work overtime, got stretched to its limits across countries, wherever you could think of it, it got stretched. One thing which came to its, I would say, rescue or did play a big role is technology. While we have the India story and I'll be talking about it, but we saw technology in areas which we had never thought of getting in. Robots being used for ensuring that there is zero infection among the medical staff, doing the administrative works, I would say the basics which were there, delivering medicine, food through these robots. Different countries looked at that. Remote monitoring became the norm to that extent. Digital consultations being there. In remote monitoring, we had the tele-ICUs as well coming in as a big, I would say, components in some parts of the world. Big data, all of us saw that the contact tracing which was there. In Indian context, it was Arogya Setu. In other places, a whole lot of other contact tracing mechanisms, especially in South Korea, Taiwan, Singapore, ensured that yes, technology is used to its best and support a sector which actually needed it. And that's where we all saw that. AI being used even for screening and diagnosis. So that became the norm in the last 2 years. Now, learning from there, that's where we probably need to take it and build on top of it. And if I look at, this is the way it's going to be. We would continue to optimize the business of today as things are happening, but also at the same time, we'll have to innovate and grow the business, which on the private sector side or the government side, if I look at, is the healthcare delivery of services. There are, yes, those traditional hospitals, they have moved to the dish-sized hospitals as well, and the connected hospitals. But more and more, as we are seeing, it is not happening in silos. People are going ahead and doing it. And that's where maybe all of us need to move towards, where there is complete improvement in access, there is efficiency, where there's personalization, continuum of care coming in, data being there all across, not only within a health provider's ecosystem, but going beyond the healthcare ecosystem as well. And that's where it gets connected, I would say, an ecosystem with smart health systems. There'll also be that a mix of working, which would be there, which would be physical and virtual, both. And it'll be I would say, a seamless switch between these two way of working. There could be consultation which happen virtually. We could go ahead to a hospital, do the physical, and then come back to the virtual. So that mixed way of working will continue, and that's where I think all of us need to do it. Lot of focus on preventive and predictive care as well. And we heard Dr. Sangeeta as well. And in earlier we did hear Dr. Sharma. So that's the way the ecosystem is going to evolve. And what we see, just to maybe look at one part of it, which is the smart hospital as a component which is evolving, which will not only maybe remain at a hospital level, but try and bring in the ecosystem together as well to it. So that's where we try and see, while patient is at the heart of it, but if I look at from the outer side of these 4 rings, which is there, lot of data, which would be there, analytics, predictive analytics, AI coming in, disease predictions happening, whole lot of algorithms getting used. So that's where I would say the whole lot of focus would be there. But hospital care, bringing in technology, whether it's IoT devices, whether it's robots getting used across the spectrum, logistics, supply chain, all that getting impacted and in a very big way, and transforming this entire thing. Second itself is a virtual care, which gets into a blended way of working, as I did mention, whether it's the outpatient part of it, the diagnostics being done from there, even remote procedures and those teleconsults, tele-ICUs, which are there, some of the virtual wards, that's something also which is, I would say, a concept which is being looked at. Medicine management is another area which will see a lot of action in the coming days. and then translating into self-care, home care even, because that's where we have seen in COVID that it was not the hospitals only. It was the healthcare delivery, healthcare services coming to the homes of all of us as well. So a lot of those smart devices being there, getting into wearables, lifestyle apps, all that is going to continue. And all of us are seeing that we are part of that entire history getting created, the way things are happening today, I would say. And it's more and more it's going to happen. If you look at the way it's happening, I would say in the country and globally as well, there are pharmacies who are getting linked. Even in the Indian context, there's a big, I would say, focus which is there. There are retail clinics which are coming up in a big way and getting connected. The lab diagnostics is an integral part of it. What we are also seeing is the insurance part, which I think some of the fellow panelists did also talk about. Dr. Ajay also spoke about it. So all that coming together as a connected or a smart hospital being there. But more importantly, if you look at going forward even beyond this, as I would put it, would be that, yes, how India scales up for them. And if you look at from a COVID standpoint, we did see anyone could have called, even during COVID, we used to get calls. Some of our team members from an organization like ours, because we operate across the length and breadth of the country, sitting in a particular district, in a hospital, being hospitalized, and maybe doctor not being available, and they getting into even teleconsults. So now technology enables that, opens that up to that extent. So Uberization of health services, that's definitely going to be the norm and is going to continue. The ground response which was there, with all the command and control setups which came in. Today also, I would say across states, those are still functional. Even though COVID has gone, they have been getting repurposed. Those command and control centers which were there, a lot of disease surveillance, public health programs are getting delivered from there. And definitely the predictability in diseases which are there, it's going to continue. And that's where I would say government is playing a very, very big role. And not only government, the private sector as well. And you could see some of the names on the screen. If you look at Tracto being there, Farmies Easy being there, a whole lot of private sector, government sector coming together and trying to make it happen. In fact, COVID has been a big success. We have been part of that journey right from the January 21 onwards, I would say, where the entire vaccination program got rolled out and the certificates were getting launched. Now we are looking at, okay, how probably that could be taken to the universal immunization. The kind of track record we have of our immunization records, the MMR which we have in the country, how do we improve that and at least have that kind of platform supporting the immunization program? Blood donations, organ donations are something which are being looked at. ABDM for sure is going to be that game changer because it brings the private sector and the government sector together. And not only the healthcare providers, the insurance companies, the pharmaceutical companies, the diagnostic labs, I would say even they're going ahead and getting into the Ayush, the world of Ayush itself and coming here, and ONDC also adding and enabling that entire environment. Somewhere, some places where EY as an organization is helping is definitely, as Dr. Kapoor said, the ABDM entire design is supporting in the way we could have done it. There's an infrastructure assessment because all hospitals do need to get into ABDM compliance. So what does it mean? Right now, we've done it from a state point of view, but this could also be applicable to private hospitals because the kind of infrastructure which is required on those aspects, the functioning of it, we've tried to look at that, and that's available on NHA's website. People can look at it and try and understand what does it mean. There are states, Bihar, West Bengal, Rajasthan, UP, multiple states who are at the forefront of adopting technology and adopting ABDM as well. Well, that's where they want to leapfrog and give a different kind of experience to the patients in these states. Even private health providers are getting into a big time looking at the ABDM compliance. And I'll, in the next slide, probably also demystify what does this ABDM compliance means. But it's more of the private sector, which can be the early adopters. And as Dr. Sharma was saying, can be those data providers based on the consent of the patient. Because today also, if you look at, all health records are in the custody of the patient. The patient could go ahead and share the data to other health providers as well. So it becomes much more seamless. And for the healthcare providers as well, the payers as well, it becomes a lot of value addition to the kind of data which could be available through this ABDM itself. Just to wrap up maybe, but to demystify what the ABDM compliance means for any hospital or any healthcare application provider, to that extent, there are 3 milestones which are there. A health ID generation should be there so that Milan in one system can probably be recognized as Milan in another system or by another health provider. Maybe it's a lab, whether it's a pharmacy. So that data based on the consent could seamlessly flow. So that's the milestone 1, which NHA prescribes we should be focusing on. Milestone 2 is that you as a healthcare provider should be able to send out data based on patient's consent wherever required. So that is the health information provider services, where you get your systems slightly tweaked so that they could share data as per the prescribed APIs. And milestone 3 is where you are able to receive data. If probably in institution, there has been an episode and a patient has been there, he's gone to the OPD or he's gone to got admitted, got some procedures done. But if he wants to show to another health provider, maybe a couple of years down the line, that data could come in. So you are able to receive data. So that's the milestone 3, which is being looked at, and would encourage all the health providers, health payers, the other ecosystem partners to get their, I would say, platforms ABDM compliant. And that's where the power of this entire ecosystem, the transformation we're trying to do, is going to be realized by all of us. And we could be part of that entire journey and part of that history, I would say. With that, I'll just pause.
Yeah. Thank you very much, Milan, for your very nice disposition on harnessing technology and what are your milestones that you have laid down, how we should move ahead with our digital health mission. That's a very good start. I think that is being followed also. I thank all of you for your elaborate presentation of covering the subject so lucidly and sharing your experiences. All I would like CAHO to do is to take over from here, because now we are just talking of scaling up technology, but these dots have to be connected, and these dots have to be connected to give a holistic, angle to the entire technology usage in the healthcare delivery system, to reach out to the unreachables. I know we have problems, but we have solutions. I also know that it is easy to cry and make things difficult for us, but I believe that to make things easier, it is better to try than to cry. So thank you very much, all of you. Thank you, CAHO, for giving all of us this opportunity to share our views